and this session is going to be about breast implants. I'm going to talk about all that breast implant surgery entails, how exactly the surgery is performed, and what exactly is achieved during this surgery. Now, breast implant surgery is a little bit controversial in our country. Controversial in the sense that people are not that open about talking about this surgery. So the patients may not be open about it, or they may not discuss it with their family or with their friends very commonly. That's because of India being still a conservative society per se. But today's talk, essentially, I'm going to focus about the science behind breast implants. I'm going to explain to you how this surgery is performed, what are the different options in terms of availability of the implants, what are the different shapes which are available, and what is the location in which these implants are placed, either submuscular, which is under the muscle, or above the muscle. So I'm basically going to cover the common questions that patients have when they want to plan this surgery. Unfortunately, internet today is a medium which is not where we get scientific information, and therefore, as a plastic surgeon, I feel it's my duty to make you all as patients more informed about the different options that are available, so that you can then take an informed decision on whatever you choose. So, when we talk of breast implants, who are the ideal candidates? So, whenever somebody wants to consider a breast implant surgery, women who have a small breast size, or sometimes there is asymmetry in the breast size where one size may be bigger than the other, these are good candidates for undergoing a breast implant surgery. And of course, it is also advisable for somebody who has low self-esteem or low confidence because of a small size of the breast. So, in any of these patients, they can consider undergoing a breast implant procedure. Now, what exactly does a breast implant do? Now, I get a lot of patients who come to me and they tell me that the present bra size is 34 and they want to be 36 or something of that sort. So, the first point that I want to make clear is that 32, 34, 36, these are measurements of the circumference of the chest area. That exactly is not the size of the breast. Size of the breast is measured in the cup size, which can be A, B, C, D, and like that in alphabets. So, what a breast implant essentially does is it gives a better cleavage. A normal breast has less volume on the upper part and more volume in the lower part. A breast implant gives much better volume in the upper part of the breast. Thirdly, normal breasts have a tendency to sag. When there is an implant inside, it gives that much better support to the breast tissue, and therefore, this tendency for sagging is corrected. So, a breast after a breast implant surgery tends to look more fuller, it tends to look firmer, and it also gives a perkier look or a lifted look to the breast. Now, there are different approaches of inserting a silicone implant in the breast. The most common approach is the inframammary approach, where the incision is in the crease under the chest. The second common modality which is available is periareolar, where the incision is around the areola, which is like a semicircle in the area around the areola. The third option is to have an incision here in the armpit, which is called as an axillary approach. The most common approach is the inframammary, because in whichever outfit that a woman wears, this area is by and large always covered. Periareolar is the second common preferred approach because this location is also always concealed. The only restriction with a periareolar approach is the size of the implant. We can insert medium size implants through a periareolar approach. We cannot use very big size implants through this approach because the incision length is quite small. Of course, with an incision in the inframammary crease under the breast, we can insert much bigger sizes of implants as well. So these are the three common approaches of inserting a silicone implant. Now let's take a look at how exactly an implant looks like. And there are hundreds of types of silicone implants available in the market. There are different shapes which are available. So what shape to go for, or what size to go for, what type of implant to go for, all this can be very confusing for a patient. So I'll try to make this easier for you to understand. Now the current generation of implants that we use are called as cohesive gel implants. Cohesive means the implant has gel inside it, which does not puncture, which does not leak, and it is in a very soft form. So by touch or by feel, nobody can make out that there is an implant inside the breast. It has that much of a normal feel. The other important aspect of these latest implants is that they have a smooth surface. The previous implants used to be textured on the surface, they used to have like small dots on the surface. The current generation has a smooth surface, and I'll explain to you in greater detail later on. Some of the implants that we have now are called as ergonomic implants. Ergonomic means in standing position, the implant looks round. In lying down, it changes its form. That is called as an ergonomic implant. So it is round and anatomical, a combination of both. The round implant is, of course, it is circular. The diameter is equal in all the dimensions. An anatomical implant is like a teardrop. So there is less on the top and there is more in the lower part. And it sometimes gives a more natural looking appearance in women. Some of the latest implants that we have also a microchip which is embedded in these implants. The microchip allows for easier monitoring of these implants. So similar to how a woman can do mammogram or how they can do a MRI, there is a microchip which is embedded in the implant, which can allow for monitoring of these implants for safety purposes. Now, there are a lot of rumors surrounding these implants. Some people see some funny videos where a woman has some implant bursting when she sits in an aircraft, and they really believe that this is a real thing. It is not, it is just a funny video. Cohesive gel implants don't ever leak. These implants are absolutely form stable. You can give as much pressure on them. You can see there is a lot of twisting being done on this implant on the right side. Nothing happens to this implant, and they are absolutely form stable, absolutely safe. Now, when we talk of shape of the implant, of course, as I explained to you, one is a round implant which has equal dimensions on all the side. So in a side view, it looks circular. So the advantage of a round implant is that it gives more volume to the upper part of the chest, which is where majority of the women have less volume. So it gives a better cleavage and a more lifted appearance to the breast. Now some women they want to have a more natural shape of the breast, or they don't want a rounded appearance to the breast, or they don't want anybody to know that they have had implants. In such cases, we sometimes opt for anatomical implants. So anatomical implants are shaped implants. So it means there is less volume on the upper pole and there is more volume in the lower part. So it goes like this, like how a teardrop is. So in the side view, anatomical implants give less projection in the upper part and they give more projection in the lower part of the breast. Therefore, what they essentially enhance is the lower pole of the breast as compared to a round implant, which enhances the upper pole as well. So, with the use of anatomical implants in properly selected patients, we can give the appearance of a much more natural looking breast. But of course, in majority of the women, the problem is always in the upper pole. There is less tissue in the upper pole. Therefore, if you ask me in my practice, the ratio of round and anatomical, I would say 90% of the cases we have round implants, and only in 10% of cases we go for anatomical implants. Now, whenever somebody wants to plan breast augmentation, how do you choose what is the appropriate plane in which this implant should be inserted? Now, if somebody is very lean, if the body weight is less than 40 kilos or 50 kilos, there is hardly any breast tissue which is going to cover the implant. In such individuals, it is always best to place the implant under the muscle. So when we place it under the chest muscle, it is that much better covered by a layer of muscle, and therefore the implant edges, the borders of the implant are not visible, and it gives a result which looks more natural. If somebody has good amount of breast tissue, usually in women post pregnancy, there is at least an inch or inch and a half layer of thickness of fat and muscle and breast tissue which is available. And in these cases, it is preferable to insert the implant above the muscle. Let's take a look at these two types. So, when we do planning in a breast implant, how do we decide what is an appropriate size for a woman? Is by taking measurements of the width of the chest and the height of the chest so that we get an idea about how big an implant can fit within the size of the breast. Of course, as I told you, it's important to see the thickness of the skin. In somebody who's very thin, we may have to use the implant in the plane under the muscle, or in somebody who has good amount of breast tissue, we can insert it above the muscle, which is called as a subfacial plane. So let's take a look at the various locations. So this is an image showing various locations of an implant. A common placement is subglandular. It is also called as a subfacial implant, where the implant sits between the breast gland and the muscle. So this implant, there is a layer on the muscle called as fascia. So this fascia is lifted and the implant is inserted under this fascia. The other option is to go under the muscle. As I said, in somebody who's very lean, there is not much tissue on the upper part to cover the breast tissue. So we elevate the chest muscle, what is called as a pectoralis muscle, and we create a pocket under this muscle, and the implant goes under the muscle. This implant insertion is called as a submuscular placement. Now, in some women, they want to have a bigger size of implant, and they also don't want the implant to be visible, or they want the implant to look more natural. So we choose the best features from both these insertion pockets, and we choose something called as a dual plane. Dual plane means part of the implant, the upper part is covered by a layer of muscle, while the lower part is covered by fascia. And this is sort of, midway between the two planes of insertion. Now, what is the difference between placing an implant above the muscle or placing an implant below the muscle? Let's understand the differences between the two. When we place an implant above the muscle, the post-operative recovery is easier. There is less pain. So on movements of the shoulder or doing any exercises, patients are able to resume their exercises like 9 to 10 days after the procedure. When we do under the muscle, every time the shoulder moves, of course there is going to be more pressure on the implant. Therefore, in submuscular placements of implants, patients need at least 15 to 12 to 15 days of rest before the soreness reduces and before they can start doing the normal gymming activities or exercise. So submuscular implants needs more recovery time. The second thing is that in sometimes in subfacial implants, there may be some numbness on the nipple areola which remains for few weeks or up to a month. In submuscular implants, because the implants are under the muscle, there is less interference with the nerve supply of the nipple, so the area of numbness is that much lesser. In some individuals where the women are unmarried and they're planning to have babies in future and breastfeed their children, we prefer to insert the implant in a submuscular plane because the interference, as I said, with the breast functioning in terms of future breastfeeding is much less. So in those who have a concern about breastfeeding after an implant, please be rest assured that breast implants do not interfere with breastfeeding. With the proper selection of the plane of the implant and size of the implant, we can ensure that it does not interfere with the future functioning of the breast. Now, these are the different types of implants which are available and different placements of the implants which are done. Let us now see what kind of effect it gives in women, or how does it really change the look in our patients. Now, this is a profile and a front view of patients to show the subfacial and submuscular implant placement. So, subfacial means there is an incision in the inframammary crease and the implant has been placed above the muscle. Submuscular means through the same incision we make a pocket which is under this muscle, the muscle fibers which have been shown. This is a pectoralis major muscle. So we create a pocket under this muscle and insert this implant, and this is called as a subpectoral implant. In the side view, if you look at it, a subfacial implant will sit above the muscle, while a subpectoral implant goes under the muscle. So that's the difference between the two. Let's take a look at some clinical cases. This was a lady, 27-year-old, whose concern was that the breast was not well developed and she wanted to have a bigger size in the breast. So we opted for a 355 cc smooth round implant, and this is her result 1 month after. You can see that the implant has given her a much better cleavage. There is better volume on the upper pole as compared to before the surgery, and overall it has given a much better shape to her breast and much more fullness of the breast. You can see it better in the side view, where before surgery there was not much breast tissue in the upper pole, and after surgery you can see that she has much better volume on the upper pole. The cleavage is that much better, and plus it has given her a lifted look as well. Let's take a look at another example. She wanted a cup size which was between a B cup and a C cup. The pre-surgery cup size was a A cup, so we opted for a 335 cc smooth round implant. And you can see that after the implant, she has a proper contour of the chest. There is a proper cleavage which is seen, and there is good fullness on the upper part of the breast. You can see it better in the side view, where changes in the breast are quite evident. There is not only a lifting which is seen in the breast, but there is proper volume on the upper pole, and there is a much better cleavage. Now, some women want to have a breast size which is quite large for their frame, and I think it is each person's individual preference of the kind of size or the kind of shape that they want to have. As a plastic surgeon, it is my duty to inform and to show them different shapes that are possible. But we do get patients who want bigger size implants. So let's take a look at a patient who wanted a bigger size as compared to what I showed you before. So this was a lady who came from Nigeria and she wanted a breast size which was quite big for her frame. So this is not something which I recommend, or this is not something I tell patients to do. But this was just the kind of result that she wanted. So on the basis of her measurements, on the basis of what kind of look she wanted, we have used a bigger size implant. Now you'll notice that whenever the implant is too big, it starts to then jut out of the frame of the body. An ideal implant should sit within this frame. When the implant is too big, it starts to jut out from the side of the chest. This is what I wanted to show you in this example. This is her two-third view. So of course, the breast implant, bigger the implant, the tighter the breast looks, or the bigger it looks. So it has given her much better volume. There is no doubt about it. The cleavage is that much better, and the shape is that much better. So if somebody wants a particular kind of look or a particular kind of shape, we can achieve that easily with the available silicone implants. Now I'm coming to one more example of enhancement of the breast using silicone implants. You can see that before surgery, the cup size was hardly a A cup. There was almost not much of breast tissue available. And after a breast augmentation, you can see that she has a proper cleavage now. There is proper volume on the breast, and upper as well as lower part of the breast has a good volume. In the two-third view, you can see that there is a great change in the appearance of her breast. So in terms of the flatness of the upper pole before, there is much better volume, there is proper cleavage which is seen, and that is how she has a proper result after a breast augmentation. Now the common things that bother people is that, okay, I am going for a surgery where an artificial implant is going to be inserted in my body. So what are the side effects that can happen, or what are the long term problems that I can have? So for such patients, I want to assure them that the current generation of implants, which I talked about, the cohesive gel implants, they're absolutely safe. With the previous generation of implants, which were textured, which had like small dots on the surface, this texturing was linked to a type of lymphoma called as ALCL, and this was seen in like one patient in 1 million. but the quality control with breast implants is so rigorous that even with a complication rate of 1 in 1 million, which is like 0.0001% of complication rate, still the texturing of these implants was stopped. Therefore, the current generation of implants that we use are called as smooth cohesive gel implants. So the surface is absolutely smooth, there is no texturing, and therefore, even this minor complication of ALCL that was seen in a minuscule number of patients, even that can get eliminated. The other complication that can happen in the long run in somebody who has an implant for 15 years, 20 years, is something called as a capsular contracture. So capsular contracture means if this is the implant, the body tries to form a capsule around this implant. Now, this capsule is seen in less than 0.5% of patients. I've been doing breast augmentations for the past almost 10 years, and I've hardly seen any of the patients come back with a capsular contracture. So, capsular contracture can be avoided by proper pocket dissection. If somebody has made a pocket which is too small for the size of the implants, all the breast tissue on the surrounding the implant goes that much tighter around the implant, and I feel that is what gives more chance of a capsular contracture. Of course, when we create a pocket for the breast augmentation, it is important that the pocket is absolutely precise. It should not be too big because the implant will keep moving, or it should not be too small because the implant will then get crumpled inside and it can form wrinkles, or it can lead to formation of what are called as ripples. And these ripples in very thin patients can be felt on the skin. So it is very, very important to plan the pocket of a breast implant precisely so that the implant sits properly within the pocket without getting too much pressure from the surrounding tissues. Now, the previous generation of implants, they were good for 10 to 12 years, and after 10 to 12 years, they normally required to be changed. The current generation of implants are almost, you can say, for life. They are of such good quality silicon that even at the end of many, many years, I have not seen any changes in these implants or any problems with these implants. So now almost you can say that breast implant surgery is something you need only once in a lifetime. So this was an attempt to explain to you some of the common concerns that people have about breast augmentation. So I would like to end on a note saying that breast augmentation has been always one of the most commonly performed surgeries in US, in Europe, even in Asia and India. Of course, in India, we don't discuss these surgeries as much, and these surgeries don't get highlighted as much, but it's a very safe surgery. The implants that are available are of very good quality. They are the same implants that are available in the US or Europe, so you need not worry about the side effects or long-term implications of these implants. And these implants are more or less permanent, they last for life. Depending upon the shape of the breast that a woman may have, the plastic surgeon will take some measurements, do some markings, and then you can come to a conclusion whether you are a good candidate for a round implant or an anatomical implant. Also, by checking the tissue thickness, the plastic surgeon can tell you whether you are a good candidate to go above the muscle or under the muscle. So the recovery is roughly 8 to 10 days for a subfacial implant, which is above the muscle. The implant which is under the muscle, you can need 12 to 15 days for recovery. After the surgery, you are given a sports bra to wear. That is very important. It gives good support to the breast tissue when the healing is happening. And we normally recommend that a breast sports bra should be used at least for a month. All our patients get silicone creams or silicone tapes, which go very well in healing, and they help a lot in removing all the scars so that after 2 to 3 months after this surgery, none of the scars are almost invisible. So, friends, this was an attempt to explain to you the science behind breast implants, to explain to you that it is a surgery which is quite safe. So, don't get affected by what your friend says or what rumors are there. These are only rumors, and internet sometimes is not the correct place to research about scientific advice about breast implants, because people they share their own experiences, and their experiences can be quite biased and one-sided, and it need not be scientific information always. So this was an attempt to give you the scientific information behind breast implants. If you would want to me to talk on any other implant a related issue, or if you want me to talk on any other aspect of cosmetic surgery, please feel free to write to me, and I'll be happy to include that topic in my next live session. Also, don't forget to subscribe our channel, Dr. Parag Telang, so you get notified of the new videos as we keep uploading them. I hope you and your family are safe, and I pray for your well being. Thank you and good night.